Chief Medical Officer Dr. Roshan Parasram is assuring the elderly population that there is no need to fear the COVID-19 vaccine. His statement comes after 23 persons died in Norway on receiving their first dose of the Pfizer vaccine, which may have been related to side effects of the shots. 13 of them were all nursing home patients and at least 80 years of age. Sunil Lalla reports.
It is too early for the Norway incident or any other incident that has not been fully investigated. There are too many confounding factors to make a determination as yet.
Chief Medical Officer Dr. Roshan Parasram says the investigation into an incident in Norway where over 20 people died after taking the COVID-19 vaccine is still in its early stages and is asking citizens not to jump to any conclusions. The incident comes just over a week after officials in Norway reported the deaths of 2 nursing home residents after they received the Pfizer vaccine. But Dr. Parasram says this country has the advantage of seeing the reactions to the vaccine worldwide before it reaches our shores.
In terms of the number of people that have been vaccinated, we're talking about millions at this point in time, and it's going up by the day. So we look at the adverse reactions that are occurring as one of the measures.
Dr. Parasram adds that the WHO has also updated the guidelines on who can receive the Pfizer vaccine.
We have to be cautious with persons with severe allergies to give those vaccines to those individuals. We have to, they are not recommending for use in the pregnant population at this time. They are not recommending use for persons under 16 years of age. And they have been found to be safe in cases of persons who do have non-communicable diseases.
Dr. Parasram says the WHO stands by its decision to have the elderly population vaccinated, and he believes this is critical.
It's always a matter of weighing the risk versus the benefit of taking any medicine or any vaccine. So even in over the last 2 weeks or so, we have noted a slow but steady increase in the number of very elderly persons presenting back to the facilities. Particularly, we have seen some in Arima General Hospital as well as Port of Spain General Hospital going quickly thereafter to the Couva facility, and we have seen the demise in those individuals.
The CMO confirms that the distribution of vaccines via PAHO is on track for the end of the first quarter of 2021, in which 15 different vaccines may be offered to member states. Sunil Lalla, TTT News.
Thank you, Sunil. Meanwhile, there has been another COVID-19 related death in Trinidad and Tobago. The Ministry of Health advised on Saturday afternoon that the number of deaths has risen to 131. Meanwhile, the ministry has reported 27 new positive cases of COVID-19. Of these, 1 is from Tobago. The ministry said the number of positive cases reported reflects the samples taken during the period January 13th to the 15th and not the past 24 hours. The total number of active positive cases is 316, with 40 patients at hospital. The ministry also advised that 9 persons have been transferred from the UE campus in Debe to Kora Hospital to facilitate preventative maintenance on the building, while 3 patients were sent to home isolation. And the COVID-19 antigen test will be used as a diagnostic tool when it is rolled out in the next few weeks. Chief Medical Officer Dr. Parasram says he had a meeting with the team involved in the process of validating the test kits, and he is hoping the results are presented sometime next week. The CMO also explains how the kits will be used when they are distributed.
It really depends on what we find in terms of validation. If it is, as the manufacturer has said, very good with picking up persons with symptoms, upwards of 93% is what they have said, then we can easily use it in a clinical setting, for example, an accident and emergency, which is where we plan to use it most of the time in a district health facility or hospital, and not more so as a screening tool, but actually as a diagnostic tool.
Dr. Parasram also adds that it may also be used on persons without symptoms to ensure that the results match.
We are also testing to see, as I said, if you have negatives coming back as true negatives. And if that is the case, we could expand the use a little bit more. For example, pre-surgical cases, that means cases without any symptoms. If you're going for dialysis, for example, we can possibly use it in that scenario.
The CMO says there are close to 200,000 antigen test kits in Trinidad and Tobago, and once validation is complete, they will be distributed to the various regional health authorities. Well, the increasing number of COVID-19 cases in Barbados could be the cause for Trinidad and Tobago nationals being stranded in that country. This from Dr. Roshan Parasram, who says he has been attempting to get in contact with officials in Barbados to assist. A group of nationals in Barbados missed their first repatriation flight last week since they were unable to receive the test results before 72 hours. On Saturday, another repatriation flight was carded to leave Barbados en route to Piarco International, but that group is still awaiting their test results. Dr. Parasram says he is exploring the possibility of having the swab sent to Trinidad to be tested.
I have reached out to the CMO of Barbados to see if they can actually assist, but because of their numbers in Barbados keep going up, they're having difficulty actually doing the tests as they should be. I would have offered that they do the swabs and we do the results here in Trinidad in one of our labs, but I haven't received any positive feedback in that regard. So I will keep communicating with my colleague, and hopefully we can lend some assistance.
Well, Barbados reported 29 new cases of COVID-19 on Friday and crossed the 1,000 mark of confirmed positive cases earlier this week, with over 500 active cases on the island.